My name is Mel Martin. I'm a ward sister on Hopkins Ward at the Royal Berkshire Hospital.
My name is Rafaela Susano, Senior Staff Nurse on Hopkins Ward.
So initially when you come back to the ward, you'll be looked after by the nursing staff on the ward. You potentially may have some drips and a line in your arm that may be giving you some fluid. You also may have a surgical drain that the nursing staff will be monitoring. We would look after you in terms of checking your blood pressure regularly, and we would check your pulse rates and other observations that we would keep an eye on. We would also be checking your wound from your surgery to make sure that everything was okay.
And I would say the first day will be more sore, more sleepy from the anesthetic, but from day one post-op, we are expected to do his normal life, sit out, start mobilizing, eat as tolerate.
So in terms of open versus robotic surgery patients often feel less pain. Their pain relief requirements are often less because the type of surgery is done differently. The wounds haven't gone through as much muscle, so they are able to mobilise a lot earlier, a lot quicker, and they feel actually a lot better in themselves. So naturally, after having major surgery, there may be an element of discomfort. What we do is we monitor your pain regularly. We give you pain relief orally, and we can also give you pain relief injections. Part of the anaesthetic that you have during theatre can last for up to 24 hours and it assists with that first mobilisation post-operatively. So there is always a nurse in charge or a coordinating nurse, as well as the nurse looking after you as your direct link. So what we always say to patients is if your nurse isn't free to see to you at that moment in time, then please do contact the nurse in charge, who will always make time to discuss any worries or concerns you may have. So on day one following your surgery, we would assess your pain. We would make sure that you had enough pain relief medication on board. We would then look to start to mobilise you to get you up and out of bed. The earlier we get you up and out of bed, usually the better that you feel. So we will get you up and get you sitting in the chair with the assistance of a member of staff.
So from post-op, after the surgery, we expect probably just drink a couple of sips of water, tea, and then from the day one post-op start having some sloppy diet that we say like ice cream, jelly, soup, and then we can build up the diet as tolerate.
So initially we would assist you out into the chair, then we would get working with the physiotherapists on the ward and aim to do 2 short walks per day. We'd like you to sit out of bed for up to about 8 hours if you can tolerate it, and that can be either in short bursts or it can be in longer spells, as depending on how you feel.
Normally the patients feel more comfortable to sit out. For example, let's say make a deal 3 times a day. For each meal they can sit out a little bit, have the meal and mobilise.
So initially after your surgery, we do like to give you chewing gum 4 times a day to encourage the gut to get going again. We'd be really appreciative if family or friends could bring that in for you, and the nursing staff will remind you 4 times a day to make sure that you've had your chewing gum. So depending on whether you've had a neobladder reconstructive surgery or whether you've had a conduit depends on the post-operative care that we give you. If you've had reconstructive surgery and you've got a neobladder, we start teaching how to look after that neobladder on day 1 following your surgery. Likewise, if you've had a conduit, we will then start working with the stoma team who will start teaching you how to look after your stoma. So before you were allowed to go home following your surgery, we would expect the following things to be addressed for you to do so. So we'd expect your pain to be well controlled on oral analgesia, so tablet painkillers. We would expect your bowels to be working. We would expect you to be up and mobile to a degree that you are happy and comfortable with to go home.
So your operation's over and you've been discharged from hospital. We appreciate that patients need a bit of time away from the hospital after this type of surgery, but your care certainly doesn't end the moment you walk out of the door. At the Berkshire Cystectomy Centre, we'll keep an eye on you for many years to come. The initial process involves coming to our clinic a few weeks after your surgery, where we'll go through in detail the exact results of your operation. The pathologist will have been through the slides related to your cancer and will be able to give us a precise diagnosis. At this point, we'll also give you a better idea of prognosis, or how you will fare in the years to come. The follow-up process is down to a protocol dependent on these results. And we'll keep very close eye on all our patients through monitoring their kidney function through blood tests, and also regular CT scans and reviews in clinics to go through the results of that. Most patients don't require any further treatment at this point, and any further treatment will be guided on based upon the results of these scans.
So at the point when you're ready to be discharged from the hospital, we understand that it's actually quite a worrying time for a lot of people and they feel quite isolated after they've gone home. It's really important after the type of surgery that you will have had to contact us if you are concerned. So following discharge, you should be given phone numbers for both the ward, the clinical nurse specialists and the surgeon's secretary to get hold of somebody should you have concerns at home. The ward is open 24 hours a day, 7 days a week, and we are more than happy to talk to you at the end of the phone. If we are concerned about you in any way, we will organise to bring you in to get assessed by one of our doctors.
Well, I think the first 2 or 3 days, you're in pain, you have to say that. You're not well, you can hardly walk. They will insist upon getting you out of bed and walking you down the ward. You've been so ill, I think, is the answer. You are so ill. And all you want to do, frankly, is get out of the place.
And you're very woozy. Still very heads sort of in the clouds, and you feel fairly numb still all over. There's no real feeling at all, but just a general wooziness, I suppose, but nothing unpleasant. Advised me to do as much exercise as I could, gently build up, not just to sit around and vegetate, and try and obviously do my pelvic floor exercises.
If I remember rightly, it was about 8 days. In that 8 days, of course, you actually see the stoma nurses who show you the procedure of actually fitting the bag onto the side of the stomach. I live on my own, and family, children live some distance away. I think the support is there if you need it, and you do find that at times that suddenly things go wrong, a bag starts leaking, and I think quite a number of people, from what I've heard, who have stomas every so often get this sort of problem. But, you can contact the stoma people and hopefully they will advise you, or even the people who supply the actual stoma bags.
Mentally, I felt perfectly all right. Physically, I had no pain whatsoever. When I woke up, I was in the recovery ward and was fine. They looked after me perfectly. They were very concerned about whether I had pain or anything, which I didn't. Yes, I had to get up. I had to be fit enough to walk on my own and upstairs, because we had stairs in our house. They needed to know that I could get up them before being discharged, which I could.
It's very, very hazy. You come round, you're not in any pain, you're high as a kite because of the drugs I've given you. And then on day 3, it was like you were hit by a truck, and then you felt just grim. Meanwhile, the physio-terrorists, as I came to know them, are trying to get you out of bed. And believe me, the last thing you want to be doing is moving around. You just want to sleep because you're dog-tired, because it really does take it out of you.
I just almost couldn't believe it, because I felt fine. I thought, okay, the time had passed. I very quickly realised that it was at night time, and I felt good in myself physically, and I didn't have much in the way of pain. They said, "Oh, there's a morphine pump if you want it." I think I only used it once to see what it was like. Didn't really need it. Hadn't got any pain at all, I didn't think, and that was fine. And you came in later that day.
In the morning.
In the
following
morning, 2 or 3 hours afterwards. And they decided I really didn't need to stay in intensive care. I think it was a precautionary thing, they put me there. And I soon realised the limitations of my mobility, because I felt fine lying down. As soon as I needed to transfer onto an ordinary bed, that was a completely different kettle of fish.
Was, when I first woke up, I came round for a short while, I think, and didn't really take much attention to anything. Basically, I was advised on the need to keep doing the pelvic floor exercises, not to do anything too heavy lifting, that sort of thing. Very surprised actually at how well I was feeling. I think everybody was surprised.
I had to learn how to do my urine bag and how to put them on and how to change them. I had to learn how to walk again because you're in there and you're not going to move. I spent most of my time asking people for painkillers, if I remember rightly, and watching telly. Right, well, I had big problems. I'm a widow and I was living on my own and I had nobody to look after me. I had arranged for, my sister was coming over from Canada but wasn't going to be over for a week. So a friend from Devon actually came up and lived with me to look after me for the first week. Now, I could sort that out, that was fine. When you're on your own, it's quite a challenge and quite a worrying challenge, especially when you've had a massive operation, you've got a huge scar, and you've got to learn to get up and down stairs and change your dressings, and you're still learning how to use your bag and what to do. So I think I found the first couple of weeks quite difficult.
And then I was in intensive care for, I think, 3 days, and very well looked after. I think one has to look at it from, you've got a lot of tubes in you. Subsequently, they've got to get you free of those, and that takes a few days. And as each one was removed, the specialist dressings were put on and checked, etc. The Gestapo turned up every day to make you walk round your bed or walk round the ward and make sure that you were moving. You didn't feel like it, but on reflection, it was a very good thing.